Do you already know Wikisana?
Welcome, dear viewers, to our format today, Natural Medicine. Chronic fatigue, perhaps also intestinal problems and other obstacles that really rob you of your energy in everyday life. How can we deal with this? What is the reason for this? And what new scientific findings are there to really get support into the system? This you will hear from our guest today, Dr. Harald Burgard. Look forward to it. See you in a moment. Hello, dear Harald, nice to have you back.
Hello, dear Karina, thank you very much.
We have already done an interview about toxopheresis, which is also a very exciting topic, especially due to all the stress. But more and more patients are coming to you with symptoms. I don't know, are they sometimes new or more extreme, or what is the current situation with the patients?
What we see again and again is that more and more people are coming who are tired, who are chronically tired, but not tired in the sense that you say, oh yes, I haven't slept enough, I feel a little tired, but they are just so flat in terms of energy, we call it fatigue, heavy fatigue, that they can't handle their day anymore. That they say, I have to think about whether I take a shower or have breakfast, because both don't work anymore. And then there are often young people too, where you think, that can't be, look, 20 years old, looks good, optically everything fits, but they can't handle a day.
And did you also notice that they were often pushed into this psycho corner, because you just say, we don't have a solution for it now, and in the end the cause is already there. You just didn't find it.
Yes, absolutely. The WHO, thank God, at some point took an ICD code for this disease, which clearly shows that it is a physical disease and not a psychological one. So the psycho corner of the topic is actually forgotten, because we know that the real chronic fatigue, myalgic encephalitis, where there are also other complaints, because we will go into that in a moment, that it is not a psychological, but a physical disease. Of course, people also suffer psychologically at some point, but that is rather the consequence than the cause.
Yes, let's go into the description. Yes, exactly.
The question is always, what happens when nothing works anymore? And often nothing works for these people anymore. Then the digestion is bad, because tiredness not only affects your head, but also the digestion of other organs. Then performance goes back from the heart, from the kidneys, from the liver, and so on. And that's why the question is, first of all, what does chronic fatigue, syndrome, and myalgic encephalitis mean at all? This is not such a lapidary fashion disease, but it is really a severe disease with the disruption of energy formation. And from that a severe fatigue occurs. You have to imagine energy formation. Our energy is formed in the so-called mitochondrials. These are the power plants of the cell, many have heard of it before. And a molecule is formed there, which is called ATP, adenosine triphosphate. You have a supply of 1.5 seconds, but you need ATP every day. You have to form ATP in the shortest possible time of your body weight. 50 kilos, 60 kilos, men 80, 90 kilos. If you do sports, it can go up to half a ton, or even higher in competitive athletes. That means it has to work. And if the ATP formation doesn't work, you get tired. And tiredness doesn't just mean tiredness of the head, but you need that in all cells. Then the liver is bad, then the intestine is bad, the heart and so on. Everything gets tired and sinks in its performance. And that's why the consequences are actually a severe physical weakness, a fatigue, a significantly limited activity. And performance in all areas, in thinking, in concentration, but also in organ function. Neurocognitive symptoms, people who can no longer perceive everyday life, they can no longer concentrate on work, they can no longer think clearly, they have fog in their head, as they always say so beautifully. Autonomous nervous system is disturbed. If your stress nervous system, your calming nervous system is disturbed, then a heart attack can occur, then the intestine can work too fast, or it becomes sluggish. And many other symptoms, or even immunological symptoms arise. People have a massive infectious disease, because simply the motor that needs energy doesn't work in the defense cells. And then they are just tired and sluggish and don't attack the viruses.
If colleagues are watching you now and say, okay, now I just have a flood of patients who have exactly these symptoms, what are the parameters for you that you should deal with, both as a patient and as a colleague, that you say, please take a look at this?
Yes, so we always have to look, what do people have first of all on deficiency, but we also have to look at what kind of stress is there. And what we see is that these people, we have known this for years, form very specific autoimmune antibodies against nerve structures and against muscle structures. And of course you have nerve and muscle structures everywhere. You have them in the vessels, you have them in the heart, you have them in the kidneys, in the heart, in the intestines. And when autoimmune antibodies are created by this disease, because there are toxins and all sorts of things in the background, then you have to recognize them, you have to eliminate the causes, and then these antibodies go back with the result. These are the main causes. And the antibodies, there are cardiolipin antibodies against heart, muscle tissue, there are autoimmune antibodies against nerves, against muscle cells, and so on. We look at them and I tell you, they are up in almost all cases. And they go back over the course of the treatment. They don't go back linearly, but they go back, go up again, go back, go up again. And with that I can help people sustainably. But according to my experience, they only really go back if I eliminate the causes. I can also pull out the antibodies with a process which is called immune absorption. Then they go back, go up again, go back, go up. Then I have a situation like this. I don't really like that when I treat them with the apheresis. I take out the environmental toxins, do something else around it, then they go back like this. I also have course curves, I can show them. That's very exciting and it's just a supportive help for people. It takes a while, it's not a treatment where you achieve success in 3 weeks. But if you do it right, then it works. And when we come to chronic fatigue and intestinal, that's the topic today, that really causes problems and becomes sluggish, then we have to look, why does the intestine often cause problems? Because it has a huge surface. The intestinal surface is as big as a tennis court. A lot can happen there. Many toxins can get into the body, that's why 85% of your immune cells are exactly behind it. If you want to treat the intestine because you are tired, because you have a sluggish intestine or because you have problems, then there are general things, we all know them. You shouldn't drink too much when you eat, so that you don't digest enzymes, avoid stress. But you also have to look, are there any hot spots that constantly spread bacteria in the intestine? If there are permanent bacteria in the intestine, it's like when strangers walk around at your house, that's disturbing. And then the intestinal flora is disturbed and then there is a reaction about it.
And all the bitter substances that we also lack, that's also such a topic.
The liver is completely weakened, we pull the bitter substances out of the food because they don't taste good and give them in capsule form again, because they are necessary. That's a thing in cancer therapy. And then you have to look, what's going on in the intestine? Is there only air? I touch every patient, all physically, and then they say to me, they are the first doctors that you have looked at in the mouth or on the belly. But that makes sense, because first I see what's going on. When I listen to the heart, lungs, and so on, especially the abdomen, I find that the vast majority of patients who are chronically ill are full of air. People think, there is a bit of air and I just had breakfast. No, that has nothing to do with it. That's also not air, that's lint alcohol and that's full of putrefactive gases, that's highly toxic substances that burden the liver, that make the intestinal bacteria drunk, that damage, that irritate the intestinal mucosa, that do a lot of damage. And that also makes you tired, because the body is under constant strain from the fight. When the liver is stressed, the Chinese say that fatigue is a cry from the liver, so that's a problem.
Yes, above all, I also had a case. There was a lady who really got metformin, HbA1c was increased and then we regulated the intestine. The issue was solved, there was no diabetes, it was just, the barrel was overrun. And then there are also such topics, I mean, it's no use to give metformin if the intestine still continues to rot.
Metformin also worsens it. It's a very good drug that you have to give in school medicine, but of course it's always like this. If someone has chronic inflammation for a long time, and we know what they do, chronic inflammation naturally leads to that the body tries to reduce the inflammation, so it permanently pours out too much cortisol from the adrenal gland. Cortisone, increases the sugar level, as we know. Then insulin is formed so that it is always kept nice and low. And then the cells become resistant to it at some point. It's like when someone comes in the evening and makes little men at your home. The fifth time I don't go to the front door anymore. And the cells do that too. They become resistant to too much insulin. They switch off, and the insulin resistance leads to that the sugar level rises and then you have diabetes. And then I have to make sure that I find the inflammation first and get rid of it, so that I can reduce the number of problems. In most cases the sugar goes down again, in combination with good nutrition, enough exercise, and so on. And if we have a patient with chronic fatigue and intestinal problems, of course I always look what's going on in the intestine. And then we always find environmental toxins again. We find glyphosate, we find all these additives that people eat. We don't find them in the intestine, we find them in the blood in the end. We find them in the eloid. When I pull the stuff out over the blood wash, I find microplastics there. But we can measure for putrefactive gases, we can measure ammonia, and if you don't get rid of that, then it makes people persistently tired. Then it's no use if I say we're doing a nice therapy, we're doing exercise therapy, or we're starting to tinker. That's all nice, they can't do that at all. If you send them for a walk, they break down on the way. And if the intestinal mucosa is disturbed because there is too much histamine, because people have a nickel allergy, also completely underestimated, because the mucosa formation does not work, because the intestinal wall is open, then permanently inflammatory, toxins are constantly entering the body, making you tired. You have to look at this and treat it. Does it still produce enough ATP?
How do you break it down?
Via blood. There are different procedures with which you can examine the ATP formation. You can do different indices where I can see exactly what the reserve capacity is. Does the patient have proton lack and so on? These are medical things where we can see very well what is disturbed and can correct it, and also see, when we correct it, that people are clinically better. I have to look, is the bowel wall leaking? Leaky gut. You can do various zonulins. Alpha-1 antitoxins and so on. Measure. You have to measure so that you can see where the patient is, and you have to measure so that you can find conspicuous values to be able to see in the control that it is normalizing. If people have a bad intestine, then the mood often drops, an enzyme is formed, IDO, which then leads to tryptophan breaking down, as a result serotonin, then the mood becomes bad, or melatonin, then sleep becomes bad. These are all things that have to be taken into account. Then the liver detoxifies, and gives its toxins through the gallbladder into the intestine, which then partially absorbs the toxins a meter further. This is called enterohepatic circulation, which I also have to break through so that the body really excretes the stuff. And what I just said, with all these chronic fatigue patients, no matter if it hits the intestine or whatever, we find autoimmune antibodies in many structures, and those can only be reduced. And we have to lower them permanently if I detoxify the body, and for this we use toxopheresis, because we get things out of it that I can't get out with anything else. And then of course it is important how you nourish yourself. When I hear people who say I have to nourish myself with full grain, with whole foods, I have to eat a lot of raw food, then the neck hair stands up because most people can't digest the stuff at all. Do the experiment, eat a full grain pie and then eat a little sugar at some point, then you go up like a gingerbread. And that makes people sick.
Yes, we also have in the nutritional science, here in the German-speaking area, a lot of individuality. So when I see an Indian doctor looking at me and sees things, I was also highly motivated and said, fasting, raw food, of course, because you get it so suggested. He looks at me and says, you must never fast and definitely not raw food. Thank you. Now I have an explanation. But that's also the issue with a lot of herbs and spices. We talked about epigenetics. How can I influence that? We don't have all of that.
Yes, as I said, we often eat too much gluten, we eat too much sugar, and if we go down the line to say raw food, full grain, I remember as a child, as a teenager, when I went to the organic store, I always said, actually the women should look great there. But I always noticed as a child that they were grey and pale and they looked somehow aged. That caught my attention and I didn't get it. And later I learned, okay, there are phytins in whole grains. That's not really digested. I've been seeing people bloated as a doctor for 20 years. that they just can't process that stuff, because the gut is not strong enough to do that. But if they go there and eat so much that they say, okay, if whole grain, then in a prepared form that is slightly digestible. If I like to eat vegetables, then stewed or prepared in a way that is slightly digestible, then I can relieve the stomach and I can only absorb what the gut is able to absorb. Everything else is rotting away. That's the problem. And that's what makes you tired, because the toxins make you flat. We know that so often. People tell me, I eat and then I could go to sleep. Yes, why? Because there are a bunch of toxins. That's what's burdening your liver. That's what's burdening your immune system. And if the immune system is burdened, it costs you energy. That's not energy free. Your car doesn't drive out of respect. It does because there's gasoline in it. That's energy that's being consumed there. And that's exactly what happens to the body. And that's why we go there and see that we relieve the body's maximum by pulling out the toxins through the toxopheresis. And it's always crazy what you find in the body. It's a blood wash where you take blood out on one side and clean back on the other. In between are filters that specifically take out these environmental toxins. And there you find colors, paints, stains, you find microplastics in everything now. You find glyphosate, you find God knows what, petrol residues, and no idea. These are all things that make you tired, that make you sick, that damage your gut, also other structures. And then of course you have to make sure that you balance the deficiencies. Many people come and have a deficiency in the substances that are needed for energy production. Q10, magnesium, manganese, various other things. Or they have viruses. Viruses turn off your energy production. If you have an active load, for example with Epstein-Barr, with cytomegaloria, then the energy goes into the basement. We know that if you get an acute infection, it feels like pulling a plug. You're dead tired.
Explain to me how far this. You told me in the pre-interview that blood is heated to 43 degrees.
Exactly.
How far this will influence the load afterwards. So does this heating in the device outside have this hypothermia effect, which I naturally have in the connective tissue?
Restricted. We do this because we go there and take the blood out, we divide it into solid and liquid. And the liquid part, the so-called plasma part, which contains the toxins, we heat to just under 43 degrees. Why? Because we can thus simply weaken the pathogen in the plasma, so that the body can attack it better. And everything that weakens the pathogen load is easier to treat for the body. It's not like hypothermia, where I heat up the whole body. I have to do that under anesthesia and so on. But it is helpful. It has other effects, but that's just one. Of course, we are also aware of the fact that pathogens are not only in the plasma, but also in all body cells. We can't get there.
Wait a minute. Hypothermia is not done under anesthesia.
Normal hypothermia not. But if I go into the very high-grade environment, then the patients are sedated. They are being sedated.
Okay, then continue.
Yes, but that's done in tumor therapy and so on. That is also done in chronic borreliosis. What we do is an additive tool that helps us to crack thermolabile, i.e. heat-sensitive toxins, so that the filter can simply remove them. These are additional effects. But of course, when I see that someone has a burden with herpes 1 or herpes zoster, i.e. shingles, etc., we also treat it additionally.
Okay, so you have a lot of these herpes stories, especially shingles. What else would you add to that?
You can always do chemical and physical therapy. I always try to make sure that I don't burden people, not with antibiotics, which you don't do with viruses anyway, but you go in and you can give things like vitamin B2 to stimulate the defense cells. You can take lysine, you can take certain herb mixtures that the pathogens react to. You can take some acids to activate the macrophages. There is a whole variety of things that you can take in, and then you can combine the whole thing with physical procedures, with reef frequencies, with NOSADs, with endolaser, photodynamic laser therapy, where you give a substance that binds to pathogens and thus radiates blood with special wavelengths, intravasal laser. This is how you destroy these pathogens. So it's a mix of different procedures that we always use, but this way you can reduce the pathogen load very, very quickly. And above all, it's about the chronic pathogen load. If you get sick suddenly, you'll notice that, then you'll be exhausted and you'll lie in bed until it's over. But we're talking about pathogen loads that rob you of energy because they're constantly running and under the radar. You don't even notice it, but you just feel bad. And because it's not acute, no one notices it.
How many Epstein-Barr viruses do we have?
This infection with Epstein-Barr viruses is about 60% in Germany. That means that's the people who had it once. But for me it's not interesting whether they had it once. What I can see in normal blood, in the IgG or IgM mirror, IgM high means you have it for the first time, IgG means you had it once. But based on this test, I can't see if you're coming now and saying, oh, I'm chronically flat. Do you still have an Epstein-Barr virus that's bothering you now? We'll take other tests that show me in the blood whether your Epstein-Barr is still active. Because that's the only thing that's interesting. And if Epstein-Barr, cytomegaloria or whatever are still active, then I have to treat them. If you only had it once, which I can see in the IgG, but I don't know if that's still an issue or not, then I'm not interested. I'm interested in what the problem is now. And you always find a mix of stimuli, whatever. And you have to treat that. And you can actually prove that in the blood.
How would you actually better your gut again? Does it regulate itself on its own when the burdening things in the body are gone or the stress?
We go there and take out toxins. We balance out the symptoms of deficiency when we prove them. And then it's about the patient understanding that he has to eat small meals. So not too much at once. Chewing well, salivating well, taking easily digestible food. So not raw food, but steamed vegetables. Not whole grain, but maybe actually go there and eat white rice or white flour. In small amounts, gluten, as little as possible, because that also releases inflammation in the body in the end. Not too much protein. Many people think you have to eat a lot of protein. And what is especially important, what we demonize in Germany, we need a lot of fat. The more fat I give the patient, good fats, omega-3, from linseed oil, from fish oil, etc., from grill or from algae or whatever, the more fat you give, the more anti-inflammatory effects I have, the more energy comes into the body and the healthier people become. We've been seeing this for years and it's enormous. But in Germany you have fear of fats, because you think that's what makes the cholesterol levels high. That's all wrong. If you do it right. And then you also do a stage therapy. So if I do the nutrition well and I detox people, then of course it's also about building up the gut flora. Then I look at a gut flora analysis and see what's missing and then give the pathogens that are missing. I don't do a watering can principle, but I choose substances that improve the E. coli or whatever. And then I see effects. I once had a patient who said, stop it with probiotics, it's all shit. It never worked for me. She was a pharmacist. And then I said, okay, bring me what you took. But then there were exactly the things in the preparation that she didn't need. And then I said, okay, now we'll take what she needs and then we'll see how she feels. And look, she felt good. Then certain complaints went away relatively quickly. It's like everything. I have to find it. And for that I need an analysis. And when I have the analysis, I can also give what is necessary. And then nutrition. You just mentioned it briefly, low sugar diet and so on. We can sometimes support the body by fasting, but not just like that, but if so, deliberately. Or by keto diet. You can achieve a lot to reduce the burden on the gut quickly. But that has to be done correctly, accompanied by a doctor or an experienced therapist. Low histamine diet. And what often causes problems in the gut is that people have a nickel allergy, but don't know it. And if you are allergic to nickel and eat things that contain nickel, there are a lot of food in it. In grain, in chocolate, in nuts, and so on. And it comes to the oral mucosa. You have a stimulation of the gut until the stuff is out again. These are often these irritable bowel people. Then you can of course support the gut. You just said it. Bitter substances, enzymes, pepsin, HCl. Some people come and say, I have a too sour stomach. The older people often have too little uric acid and that's why the stomach closes. And then you run up in the width. And then you have too much uric acid and then they get acid blockers. The completely wrong way. Not always, but often.
And then more parasites.
Yes, and then there's that. And that's why you have to relieve the burden with detoxification and make sure that the gut is reasonably relieved by a digestible good diet and so on. And then you get the fatigue in the gut away. Then you get the fatigue in the whole body improved and gone. But it's always a concept that you have to consider everything.
Great. Exciting topic. It probably won't get boring in the future either. I think the demand for such methods will continue to rise because the poisoning is there.
and our food will not get better.
Yes, exactly. It's not just the food. It's the clothes, it's everywhere. We get it out of the air, the most of the microplastics.
We've seen for years with children and teenagers that they have a high tin burden. And then you ask me where that comes from. Clothes. They wear clothes, the colors are fixed with tin, they sweat. Yes, it dries again. They pull the stuff into the body and you find the burden. These are toxic metals that make you sick for many years in combination with many other things at some point. These are things that are simply considerable and you have to take them out.
Great. Thank you very much, Harold.
You're welcome.
See you soon.
See you soon.
Dear viewers, I hope you were able to take a lot with you. It's always great when we have the opportunity to get the toxins out of the body. Proof of that. And I wish you all the best. Thank you for watching. See you soon. Bye.